Hello, everyone. Welcome to Arizona Visionaries. This is the inaugural meeting, part of the Foundation Forums for Blindness series. I'm Michelle Glaze, Director of Professional Outreach for the Foundation Fighting Blindness, global leader in driving retinal disease research. And we are excited to have a great lineup of presenters on tonight's first Arizona Visionaries call. Thank you all for joining. Just wanted to let you know that this session will be recorded this evening. And the Foundation Forums for Blindness are an opportunity for professionals in local communities all over the United States to come together with their local forums to do some resource sharing. And the goal of these forums is really for professionals in markets like Arizona to showcase and highlight different resources available for individuals with vision loss or blindness. Our Foundation Forums meetings occur once a quarter. So this is the first Arizona Visionaries meeting. The next one will be in January. We do encourage all of you to invite other professionals who might be interested in participating to join future meetings. As I mentioned, the session will be recorded. All of the information about the presenters will be listed on the forum page. If you want to follow or take a look at that page, you can visit fightingblindness.org/foundation-forums and select the Arizona Visionaries link. Tonight we have a really great lineup. We've got 5 different presenters. So we're going to start things off by introducing the founding members and each of the presenters. We will give each an opportunity to share and showcase information about their organization or service and how it provides support to the low vision and blind community in Arizona. After all of the presenters have had the opportunity to share, we will have a Q&A. If you have questions as the presenters are going through, please feel free to enter those in the chat or just make a mental note. We will open up for questions after all the presentations are complete. And then we will have also some an open time for any of our founding members to showcase or highlight anything that they want to share about events upcoming in the local community. So with that, I will say thank you, and we look forward to a wonderful array of presentations. I'm going to hand things over to Andrew Kim, our professional outreach coordinator at the foundation, so that he can introduce our presenters for this evening. Andrew?
All righty. Well, thanks so much, Michelle, and thank you to everyone on tonight's call. So to kick things off, I'd like to first introduce our founding team members, some of whom will actually be speaking during the presentation portion of this call. The founding members were very instrumental in setting up the Arizona Visionaries Forum, and we're so grateful for their participation in getting this forum off the ground. And I would just like to give a little bit of time to each of our founding members to just briefly introduce themselves and maybe share their connection to the foundation. So I'd like to first start off with Artemis Shamamian. She is the education chair for our Phoenix chapter. So Artemis, please.
Hi, good evening. Thank you for having me here. I'm education chair here for the Phoenix chapter. I got introduced to the foundation in the late 90s. So I've been around for a while, but mostly in Los Angeles. I have Stargardt's disease, and part of our campaign at that time was to get the foundation to think about Stargardt's too, which they did shortly thereafter. And we worked really hard to raise money and awareness in Los Angeles. So when I moved to Phoenix, I met Phi and, just followed the Pied Piper and became an education chair here, and hoping that any of my expertise that I bring to this particular project helps to get the word out.
Thank you so much, Artemis. Your work is definitely not gone unnoticed, so we appreciate all the efforts that you put in over the years.
Thank you.
So I think we have Michelle is joining. So Michelle Zunitch is also another founding member. Michelle, if you could please introduce yourself.
Hi, everyone. My name is Michelle Zunitch. I started working with Foundation just a couple of years ago as part of the Phoenix chapter. Many years ago, I came to Phoenix and started working with a Retina practice who would participate with Dining in the Dark and Vision Walk, and I found myself wrapped up into this great, wonderful cause and have not left since. So it's been amazing. I enjoy working with Phi and recently met Artemis, and it's been fantastic. And I'm super excited for this new journey that we're on all together.
Right. Thank you so much, Michelle. Thank you for your support as always. Next to introduce themselves is Dr. Carlos Grandela. Dr. Grandela, please introduce yourself. I believe you are on mute, Dr. Grandela.
Hi there, everybody. I'm Dr. Grandela. I'm sorry I don't have video tonight, but so I am the local low vision optometrist at ViewFinder Low Vision Resource Center. And we are just about the only major private practice practicing low vision in the state of Arizona. There's a few others who are out there, a few part-timers, a few places like Midwestern University, but I'm the only one who's here 5 days a week, through the whole year. And so we do 100% low vision all the time. Shh, sweetie. And everything from bioptics to magnifiers to specialty glasses, video magnifiers, assisted tech, and more.
Righty. Well, thank you so much, Dr. Grandela. We'll go into more detail, hopefully, once we get to our presentation started. But thanks again. And then finally, we have Tom Perski as our final founding member to be introduced this evening. Tom, please introduce yourself.
Hello, Visionaries. I like that name. And it's great to be here tonight. And as Artemis says, I go way back with the foundation, actually to the beginning of 1990, and got quite active back in those days, and have gone back and forth between Chicago area, Illinois chapter, spent lots of time in Arizona, went back to Chicago, and now I'm finally back to Arizona for good. And I have Stargardt disease also, so we're part of that Stargardt club that we all love and enjoy. And so I'll talk more about what I've been doing recently, and look forward to hearing from everyone.
All righty. Thanks so much, Tom. And we look forward to hearing from you in a little bit as well. So thank you all for introducing yourselves and your support for the foundation. And with that, let's move on to the presentations for this evening. So just as actually a quick reminder, so we're going to have 5 to 7 minutes for each presenter and to discuss what their organization offers the blind and low vision community. We're also going to hold all our questions for the Q&A portion, but please feel free to type in any questions that come up in the chat, or just make a note of it when we reach the Q&A portion. So with that, let's kick things off with Dr. Carlos Grandela, owner and vision rehabilitation optometrist at ViewFinder Low Vision Resource Center. ViewFinder Low Vision Resource Center is an organization that works to improve the quality of life for those who are visually impaired through awareness, resources, and solutions. So, Dr. Grandela, please tell us more about ViewFinder.
All right, so ViewFinder was originally founded in 1992 by Dr. Lynn Noon, who many of you may know. Dr. Noon was pretty much the only one doing low vision in Arizona for quite some time. And our mission is to assist those who have vision impairment through access to tools, resources, and education. As many of you know who have vision loss, one of the biggest problems is that we don't know what's out there and what's available. So it's my mission to try to spread that awareness to everybody that we see, and then help them choose the appropriate tools to manage their daily lifestyle. So we do that through a clinical low vision evaluation. That could be, resulting in a pair of glasses. That could be resulting in something like magnifiers, assistive technology, other tools like that, computer accessibility training. We work pretty hand in hand with a lot of different groups here in Arizona, from several nonprofit groups who do things like cane training to the State Department. So we'll give recommendations to the state of Arizona if somebody's trying to get back to work and vision is getting in the way of that. Well, what kinds of tools would help them to get back to work? But it's quite a bit more than just going back to work. It's how do you live your daily lifestyle? So we see everything from babies to my oldest patient was 104. And so whatever somebody needs to do their hobbies or go to school, or it's really about what do we do with that vision that's left over. So it's not enough just to give somebody a pair of glasses and a diagnosis. It's how do you adapt to those many times continuing changes in vision loss. And so we don't just have a evaluation, but we often have a series of visits geared on looking at all the different devices and finding what fits for each different activity, followed by training with those devices, or in the case of things like bioptics for driving, training preparatory to doing behind the wheel. We may be doing some, light computer training. We don't go as deep as the assistive tech guys, but a lot of those basic resources that people can get access to without, a paywall or without heavy technology. And then, trying to bridge that gap between healthcare providers who are keeping the vision from getting worse or treating the vision, and those other functional people who are going to assist in training, going out to somebody's house to do training at home. How do you cook with vision loss? How do you use a computer with vision loss? How do you walk with vision loss? And so we really try to take somebody who has no resources and just start to feed to them this immense group of people working in Arizona who have all these connections. And we're now based in Mesa and Phoenix. We go to the Foundation for Blind Children every Tuesday and Thursday. And we're up in Prescott once a month and down to Tucson once a month, and go out to Utah about once every quarter at this point. And try as I may, I'm the only doctor at our practice. It's hard to find other low vision doctors and harder to keep them. So it's just a pleasure to be here with everybody, and appreciate all the efforts you make to spread awareness and get people moving forward. We've got to keep that forward momentum. We're working on a few other projects like low vision support groups and anything we can do to continue daily lifestyle and well-being and looking at the whole person instead of just their vision.
All righty. Well, thank you so much, Dr. Grandela, for all your efforts to support the blind and low vision community. It's great that ViewFinder has such a comprehensive list of offerings for this community, because as you said, we gotta be able to make do with the vision that you have left, and it's important to live a full and independent life to work on those skills. So thanks again, Dr. Grandela. Okay, so up next is Tom Perski, the Low Vision Service Director at People Who Care. People Who Care is a nonprofit organization whose mission is to provide transportation and non-medical services to adults who are unable to drive due to aging, disability, and vision loss, so that they may continue to live independently. So, Tom, please tell us more about your organization, People Who Care.
Sure. Thanks again for inviting me to come, and really excited. I've been in the field of low vision rehabilitation actually for more than 40 years. So I have a little bit of ancient history to share. I was diagnosed, as I mentioned, with Stargardt macular dystrophy at 18 years old. Dr. Alex Krill at the time was a kind of world famous doctor, and during my 20s had a difficult time coping, and was declared legally blind about age 22 and had to stop driving. I had dropped out of school, and through the help of the Department of Rehabilitation later in my 20s is when I went back to college and graduate school. Was able to do that with help from the state, and that's when I got involved with more low vision. I wanted to meet others with low vision in Chicago, and started a support group and found out it was the very first one ever in Chicago. And the local CCTV salesman gave us the mailing list, and 65 people showed up at our meeting. And that group grew into many, many other groups. And that was 1983, believe it or not. And I was pretty well known in Illinois. And by 1987, the Wheaton Eye Clinic decided to open the currently called the Spectrios Low Vision Institute. I was one of the first to be hired as director of counseling. And we saw hundreds of patients every year under Dr. Alfred Rosenblum, Dr. Tracy Williams. And I worked under those guys for 9 years, and I really learned a lot from them. And that was really a great way to actually launch my career. What happened next was that Dr. Fishman, who was a professor of ophthalmology, also on the board of FFB, contacted me and said, I would like you to start a Stargardt Foundation. And I said, I don't know how to do that. And he said, no, I'm going to help you. And he had some of the top doctors in the country Dr. Ed Stone and Dr. Richard Welliber and Paul Sternberg from Emory. So these guys all were on my advisory board, and we started corresponding with families, maybe about 2,500 families over 12 years. And we held conferences, and that's when I got involved with the foundation. Because of my work with Dr. Fishman, I was asked to be an opening speaker panelist starting in 1990 at the Visions Conference, 92, 94. In 1994, I moved to Arizona, and actually my wife and I decided to open a for-profit business called Southwest Low Vision, which we had for almost 15 years, serving people in Tucson. And then we hired staff, and we started traveling to rural areas of Arizona and New Mexico. And that's how I got to know most of the Southwest. And it was a pretty amazing time. And during that time that I was working there, I was on the board for the local organization called Savvy, later became the president of the board there. I worked with the Arizona AER, the professionals, and then also the Department of Ophthalmology at U of A, which I was on their community board, and they asked me to start seeing patients there, which I did for many years. So then I was hired back to Chicago, to the Chicago Lighthouse for the Blind as Senior Vice President of Rehabilitation. And I was there to do some amazing things for 10 whole years, and got involved with a lot of assistive technology and worked for quite a few companies as either a consultant or as a employee. Humanware in Canada, eSight in Canada, Iris Vision in Silicon Valley. So in 2020, I got to Prescott, and I found out that there was no services here at all in all of northern Arizona, and there really had never been, which I was a little bit surprised. I started a support group here in 2022, and then the People Who Care organization saw me at a lecture, and they all came running up saying, Tom, we need someone like you. Could you please work with us? And I said, no, I'm retired. And we sat down and wrote some grants and developed an idea of a time where both my wife and I can sit and talk with patients. And then I can do a little evaluation. I do talk to them about their what they're going through medically, refer people to maybe specialists, refer them to Dr. Carlos. We do a lot on technology, iPhones, iPads, all of that kind of thing. And we continue to meet with about 100 patients per year. We also have a low vision course that's was started by 2 women who've been doing that for quite some time now. And I'm doing more of an advanced low vision class. And then this is all done, we're volunteering our time. There's no charge for the service. We don't sell anything. We just let people know what's out there and where they can get the products that they need. Finally, the support group leaders have asked me to come around throughout Arizona these last couple of years and give presentations. And we all are getting to know each other. So we're forming now a pretty informal organization of support group leaders throughout Arizona called Support Group Leaders Consortium, I guess we could say. And this next year, we're going to be a little more organized and be able to refer people back and forth throughout the state.
All righty, Tom. Well, thank you for telling us more about your amazing background and about your organization, all the organizations you worked for. It's great to see how much has changed over the years and how much more support there is for the low vision and blind community. And thank you for being one of those drivers for that, Tom.
Thank you.
All righty. So next up, we have Michelle Zunitch. She is the practice administrator at Retina Macula Institute of Arizona. The Retina Macula Institute of Arizona is an organization that provides the highest level of care using cutting-edge technology and expertise to preserve a patient's sight. So, Michelle, please tell us more about Retina Macula Institute of Arizona.
Hi, everyone. Okay, it's going to be tough to follow Dr. Grandela and Tom because my information is definitely not as cool as theirs, but so I am the practice administrator. I work with Dr. Mark Bearcat. I have been in ophthalmology for almost 30 years. About 18 years ago, I left general ophthalmology to join a retina practice. They were heavily involved in clinical research, and it became very near and dear to my heart. I'm very, passionate about clinical research and the opportunities that it brings to, patients, our family members that are coming behind us. And it's very exciting to see all of the things that have happened over the last 18 years in clinical research in ophthalmology, and retina specific is my background. So last year, Dr. Bearcat left the practice that he was at, and I left as well. He opened his own practice in January of this year. So we've been building. We are both heavily involved in clinical research. So he provides full retina care, as well as we have a part-time uveitis specialist. And they are both, again, heavily involved in clinical research. We do studies for all areas of retina research, as well as now uveitis studies, retinitis pigmentosa, Stargardt's, macular degeneration, vein occlusions, all sorts of things that we are troubled with and trying to find better solutions for our patients. I also have been very passionate and historically worked with folks at the foundation in trying to bridge that gap for our patients who are receiving these diagnoses and their family members, bridging the gap, getting patients to physicians like Dr. Grandela so that they can have access to low vision aids. Also getting them connected with foundation so that they can find a support group and a support team and know that, they are not the only ones out there. I definitely am very excited for this group.
Michelle, your sound cut off for a second.
Am I back?
Oh, there you go. Yeah.
Oh, okay. So sorry.
No worries.
I'm having some bad weather in our area, so I apologize if I cut out, but can everyone hear me okay?
We can hear you loud. At least I
Okay.
can.
Okay. So I just wanted to finish, and again, I'm just wrapping up. I definitely feel it's very important for us in the retina community and the vision community at the provider level to figure out how we bridge that gap between our patients, our providers, and everyone that has wonderful resources, Dr. Grandela's of the world, foundation, and just making sure that patients know what they have out there and what's available.
Alrighty, Michelle. Well, thank you so much for that presentation, and thanks for all the great information you shared with us. And thank you for your work and your contributions to this endeavor. Okay, so next up we have Phi Mo. He is the president of the Foundation's Arizona chapter, and he is here as actually as a representative for the Achilles International Running Club. The Achilles International Club is a global organization that transforms the lives of people with disabilities through athletic programs and social connections. Phi, please tell us more about Achilles and how its running club can benefit folks in the blind and low vision community.
All right. Well, thank you. And thank you, everybody, for joining us this evening on our inaugural Arizona Visionaries. It's very exciting to kick this off. And thank you to Michelle and Andrew and to our founding members for this opportunity. So as Andrew mentioned, I'm the Arizona chapter president. I love that. I love the role that I have there and the people that I get to meet, the people I get to work on together on the leadership team, specifically here with Michelle and Artemis, who do amazing to just branch out and reach out to our community. So as Andrew mentioned, I'm here actually to represent a different organization that I have been a part of for probably for the past 6 years, I would say. And I recently took on the role as our chapter leader here in the greater Phoenix area. So to explain about Achilles, I thought I'd actually ask you all to imagine, if you will, imagine that you made a goal to run your very first half marathon. And you've decided to like, all right, I'm going to run in this race coming up in about 4 months. So you do all this training and you put a plan together with your coach and you complete the plan and you get to race day. And so now you're standing in your corral, and the corral is like basically the time based upon your average mile pace. So you're in your corral, maybe there's like 150, 200 other people in your corral, and you're standing there and you're waiting for the start, and you're just standing there amongst others in the crowd who are anxiously awaiting the start of the race. So now imagine doing that with your eyes closed or maybe with limited vision. So simulating like being blind or low vision. Now that really changes that experience. Now you can't really see the other people around you, maybe not even at all. You're not exactly sure where to go or how far to advance, and you're kind of maybe a little anxious standing in your corral by yourself. And so that can be a very this is a very anxiety driven moment, right? So it's very difficult to try to navigate that. And you may even be wondering to yourself, like, why did I decide to come and do this race? Like, I can't even see how to start and where to run to. Well, now imagine you've got two guides. You have one standing next to you and another one that's tethered. And what that means is you're holding on to like a rope, if you will, or it's around your wrist. And your guide also has one around his or her wrist. And there's about 18 inches of slack between the two of you. So now, instead of running this by yourself or trying to navigate this course by yourself, you actually have two guides who are going to keep you safe, give you cues, audio cues, if that's what you need, and help you navigate the course. The one that's tethered to you can help bring you into less crowded areas, and then your guides the whole time are finding the path in the course to help you navigate so that you can be safe. They'll let other people know if you are somehow passing others, in that you need to pass others. They'll let them know that there's someone who's blind or vision impaired coming through or whatever condition. And now they're helping you navigate this course. So you've run your whole, 13 miles, if you will. You've got 0.1 left, and you're about to approach the finish line. And as you're getting close to the finish line, you kind of looking around and then kind of realizing, taking in the moment, and you hear and you see your family cheering you on right there at the finish line, cheering you on as you get ready to finish this amazing race that you've and goal that you put together for yourself. And so you pass by, give them a little wave, get a little teary eyed, just thinking about like, wow, I'm actually doing this and crossing this finish line. And then you go and you cross the finish line with your guides and high five each other and celebrate and enjoy. So that actually was my experience 2 years ago. I ran my very first half marathon. Probably my last one. I can't say I love the experience because it was very difficult to train, but I really wanted to do that. So I was able to achieve that goal. And honestly, it was because of my involvement with Achilles that I had that opportunity to uh, even put a goal like that forward, to try to run 13 miles and to train for that and to be safe on the course to run through that. So that was my experience 2 years ago to actually run. It was in my involvement with Achilles that I even decided to even set that goal. So and I want to tell you a little bit more about Achilles. Andrew did a great job, giving some information as well. So the mission of Achilles is to break down barriers to race start lines and empower the disability community to cross the finish line. So I know we're focusing kind of on blind and low vision community today, but with Achilles, they actually are open, they can help anybody with any kind of disability. In our local chapter, we have people who are deaf. We have people who are use wheelchairs to race. We have people with other disabilities, and we all are together there just to run and exercise. I've been talking a lot about running, but Achilles also is involved, helping with walking as well too. So if you don't want to run, you can absolutely walk. They also branch out into like triathlons and other opportunities. So and as an organization, Achilles International Organization, there's actually 34 chapters in 17 different countries around the world. And here in the United States, we have 28 chapters in 19 states, which includes Washington, D.C. And hopefully that number will continue to grow. It's just a great organization and headquartered in New York City. So I'll share a little bit about our local chapter here. As I mentioned, we are part of the Greater Phoenix chapter, and we focus in this Phoenix area. There's also a chapter in Tucson, so we have 2 chapters actually here in the state of Arizona. As far as our chapter here in Phoenix, we help athletes reach goals that they never thought they could achieve or thought they'd even present. And that was my little story earlier about my goal of running a half marathon. Upcoming actually in the next week or 2 weeks, we actually have 2 athletes, one who is running in the New York City Marathon this coming Sunday. So that's just an amazing feat. Achilles participates in that and helps provide guides for athletes for that. As far as here in the Phoenix area, our season is from September to May. And right now we meet for monthly group runs on Saturday mornings. We are looking to potentially expand and have a second group run, so 2 in a month. Hopefully we'll start that in January of 2025. And participants, we also participate in several different races around the Valley area. Like our next race we have coming up is the Phoenix 10K on November 10th. We're also going to participate in the Hot Chocolate Run in December, and also the Mesa Half in February, and also the Pancake Run in February as well. So it's always fun to participate in those races that provide you food afterwards. We welcome new athletes and guides, and we'll train guides on how to help with the different athletes. So in Achilles terms, I would be considered an athlete. And then guides are ones who are fully sighted, who probably have have an experience running in the past, and they would be guides to help athletes in their course and in races and so forth. We also we welcome runners and walkers, as I mentioned earlier. So not everybody runs. We have a very strong community of folks who just want to walk, and I think that's great, especially in our low vision community, because it can be very isolating, very lonely sometimes if you're concerned about being safe outside or getting out to run or walk. Achilles can provide provide guides that will help with both running and walking, and in that instance. I mentioned some of the upcoming activities that we have. Our next group run is on November 16th, and we'll have more of our runs schedules and races out on our Achilles site. And I think Andrew's going to provide information to that. So if anyone is interested, you can sign up to be a part of our chapter. You can be added as a guide, anybody on this call, or if you have folks that you know who might want to be a guide or an athlete, we welcome everybody to sign up and then just join us. Just get outside, walk, run, and just be healthy. So yeah, thank you.
Thank you so much, Fi. It's awesome to know there's an organization like Achilles to help folks in our community and others as well, but focus on our community to be able to enjoy the sport of running. And it's crazy that you did 13 miles that way. It sounds really tough. I couldn't even do that. So that's super cool. Thanks again, Fi. Okay, so for our final presentation this evening, we have Lily Vu Bogan, Chair at the Vision, Rehabilitation, and Technology Expo Association, or VRATE for short. The Vision Rehabilitation Technology Expo Association is a nonprofit organization that works to increase educational, employment outcomes, and quality of life for Arizonians who are blind, low vision, or deafblind. So Lily, please tell us more about your organization.
Thank you, everyone, for having me today and to give me the opportunity to speak about VRATE and our conference. We are a nonprofit organization that plans and puts on an annual conference. It's called VRATE for short, and we've been around for 28 years. So this Friday, November 1st, just so happens to be our 28th annual conference. It's going to be held at the Ability 360 Conference and Sports and Fitness Center. So the whole facility is being used this Friday. The exhibit hall is going to be in the Sports and Fitness Complex, and the presentations will be in the conference center. The address is 5025 and 5031 East Washington Street, Phoenix, Arizona. I do welcome everyone who's on this call to join us. All attendees are free of charge. The conference is for the blind, low vision, deaf blind community, but it's also geared towards family members, caregivers, educators. We've got healthcare professionals, employers. We've got state resource centers, and along with assistive technology companies. This year, we've got 47 exhibitors in 50 spaces. So we have 50 booths set up. We've got 2 stages for breakout presentations in the exhibit hall. And we've got, I believe, 14 presentations in the conference center. We have wonderful sponsors this year, 3 platinum sponsors and 7 gold sponsors, including our Dr. Grandela's low vision office, ViewFinder Low Vision Resource Center. So we've got wonderful community partners who support our conference, and it's definitely an annual thing to get together the blindness community and all the resources and people who work within the community. So it's a great event. It starts at 8 a.m. for our keynote presentation. She's going to be best-selling author Barbara Hinsky, who has created a book series called Guiding Emily, and it has been adapted into a movie, a Hallmark movie. And she has, she was actually a person who went through the Foundation for Blind Children just to see how the center was set up. And she got a tour, And from that tour, she created a whole series of books. And her main character is a blind woman who is lost her vision as an adult and had to find resources to start working again and become independent again. So it's a story that a lot of us blind people, low vision people have gone through ourselves. I myself had to do the same. And so it's a wonderful series. We do have Foundation Fighting Blindness exhibiting at our event as well. So they'll be there along with many other exhibitors. And they're also with Dr. Bacall from Associated Retinal Consultants. I don't know if I got that right, but he is going to do a presentation at 9:15 in Conference Center, Conference Room 1, about inherited retinal diseases. And that's, I believe, with FIMO. And so I believe I checked off all my points that I wanted to talk about, but I am definitely open to answering any questions. Again, it's this Friday. It's going to be at Ability 360. The exhibit hall opens at 9. We can start checking in people at the registration tables at 7:30 a.m.
Hey, all right, Lily, thank you so much for all that awesome information. And it's so nice to know that there are so many, or yours as well, different events that are meant for the education of low vision and blinding diseases. So thanks again. So right now, I think we can start our Q&A portion. So Michelle, I should hand things over to you, and we can start getting some questions on the board and getting some answers as well for anyone on the call.
Absolutely. Thank you, Andrew. While folks are thinking about questions and compiling questions, I just want to say thank you to all of our presenters. I feel just really grateful and inspired to be surrounded by so many professionals that are just doing amazing things for our community. At the Foundation Fighting Blindness, our mission is to drive research to find treatments and cures for blinding retinal diseases. And of course, that provides those of us with vision loss hope for a future with potentially some sight. But in the meantime, we all want to live and thrive and enjoy life. And all of you provide support and services to enable us to do that. So it's so wonderful to hear about all the Arizona organizations that are providing guidance, providing adaptive sports, great medical care, low vision rehabilitation, conferences, community. And I'm excited that the Foundation Fighting Blindness is part of that. So thanks to everyone on the call. I do want to be able to open up for questions that anyone has. I have a couple of questions that I can certainly share, but I want to open it up to our attendees before I fire anything off. So I'm going to pause and see if there are any questions out there. And Andrew, if there are any in the chat, please share those.
Don't have anything in the chat just yet, Michelle.
Okay. Well, hearing none, I'm going to start. I do have a couple of questions, just general in nature, but maybe they'll get some conversation going. Dr. Grandela, I wanted to ask you, what inspired you to want to become a low vision specialist? How did you get your start?
Thank you, Michelle. So I graduated out of optometry school in 2018, and part of optometry school year last year is a series of internships at doctors' offices. So I did my internships in Utah, and I was part of a practice there that focused on vision therapy, but happened to be at the only practice that really worked with carbon monoxide poisoning. So there was a doctor in Utah, Dr. Weaver, who was kind of nation renowned for handling carbon monoxide poisoning. And whenever he caught a case that had binocular vision dysfunction, so we're thinking like double vision, things like that, he would refer that to the doctor I was working with. And so I got to see a series of these patients who were flying in from Georgia and Detroit. And it was really intriguing to me. It's very similar to stroke, where this is a lack of blood flow, oxygen getting to important parts of the brain. And so somebody has carbon monoxide poisoning could have very mild symptoms, could have very severe paralysis, vision loss, all the way up to death. So it could be lots of different things going on. And I remember saying to my doctors, like, yeah, we can help these people. We can teach them some of these visual exercises. We can give them a new pair of glasses, but what do they do with the rest of their life? And there wasn't really a good answer for that, you know. So that was part of what really spurned me to go on to do a low vision residency. And like Tom, I spent some time at the Chicago Lighthouse for the Blind. Yeah, I think you spent more time than me. I only got 1 year, but 1 year in Chicago was enough for me. I'm not made for the snow or the big city. And about 2 weeks after graduating from my low vision residency, I was here working with Dr. Noon. I knew kind of from the beginning that I wanted to be all day, every day low vision. And so since 2019, I've been here doing it and haven't looked back. I don't know that I would know well enough to do any other kind of optometry at this point.
Well, that is an interesting story. I'm always intrigued by how folks get into the field. Your story is very unique, Dr. Grandela, so thank you for sharing that. Appreciate it. Another question that I had is to Michelle. You know, through professional outreach, one of the things that we talk about all the time is the importance of continuity of care, right? And when a patient comes in with vision loss due to either an inherited retinal disease or age-related macular degeneration, and they go to their retina specialist, you know, that referral process and getting them connected with low vision specialists, low vision rehabilitation, local organizations, community is so important. I was so glad to hear that that is part of what you all do. Michelle, can you share a little bit about how you go about just really referring folks out and keeping abreast of all of the different resources out there and available to patients that come to your practice and see your physicians?
Yeah, so it has definitely been something top of mind since opening the practice in January with Dr. Barakat. For many years, I've seen patients come in and out of clinics with their families, and they, not all physicians operate the same way. Not all physicians take the time to have those conversations with those patients. And it's one, I've shared this many times with, Artemis and other folks that I've talked with. It is one of our missions. We really strive to make sure that patients, when they leave their office, we are not the only provider. It doesn't stop and start with us. It really starts at the optometrist level. They're, general ophthalmologists, folks like Dr. Grandela with low vision, we refer a lot. We utilize Midwestern. We travel throughout the state of Arizona to provide retina care to patients, and we share all of those resources. It is one of the main reasons I volunteered with Foundation Fighting Blindness. I'm really passionate about connecting that information.
Nope.
I think we're losing you, Michelle.
Oh, we lost Michelle.
Okay, all right. Well,
and resources available.
Oh, there we go. She's back.
There she is. We lost you for just a second, Michelle, but I think that we heard most of what you had to say. So if you can hear me, thank you for sharing, and thank you for your direction in ensuring that your patients have connections to resources that they need in order to continue to get the support and services that will help them thrive. Tom, I was curious, can you share a little bit? You mentioned some support groups throughout the state of Arizona. if any professionals wanted to refer someone to those support groups, how would they go about doing that? What's the best way to get involved?
Yeah, and that's part of what our loosely organized group is all about. And so that people can email me, and then we can provide a list. Dr. Grandela, on his website, I believe we gave him also just about all of the groups. And so we talk about that, and I do as one Zoom meeting every month with his patients, so we always talk about resources, and that's a good place to go is ViewFinder low vision website.
If I can
Wonderful.
chime in on that too, Tom, I would just say if anybody has a low vision support group that they would like added, be happy to upload that to the website.
Terrific.
Thank
And
you for that.
we actually do have a question from Dr. Grandela that he put in the chat for you, Michelle, actually, Zunitch. Are there any low vision support groups at the Retina Macula Institute?
Can you all hear me okay?
Yes, we can hear you.
Dr. Grandela, we have not started any yet, but something definitely we're very open to. Again, Dr. Bearcat and I just opened practice January 2nd of this year, but we are definitely very interested and open to having those conversations if anyone has the need for us.
Can I chime in on the support groups? Because our local Foundation Fighting Blindness website actually lists support groups in the area.
Artemis, thank you for sharing that. And on that note, Phi and Lily, you mentioned some upcoming Achilles and VRATE events and conferences for our team, and we have many members of the Foundation Fighting Blindness local chapter. Are there any Foundation Fighting Blindness local events that you wanted to share or showcase in the upcoming months that people might be interested in attending or participating in?
Well, we've got our big gala coming up on November 10th. It's called the Night for Sight. We're going to be having a farm to table extravaganza dinner, a gastronomic experience. And then we've got a surprise for our entertainment portion of the evening as well. We're going to be having a star tour since we're going to be at the farm outside. And they're going to be talking about some of the new technology that is descriptive audio, so that those of us with low vision or going blind can actually look through a telescope and then with the descriptive audio get an explanation as to what we're looking at in the night sky.
And how do people learn more about that event or get tickets? Can you share the best way to do that, Artemis?
I don't have the website on the top of my head, but I bet Phi does.
I can help with that, and thank you for sharing about that, Artemis. So on actually the Foundation's chapter page for Arizona, we have that event listed right there, basically in the middle of the page, where you can get more information about our Night for Sight event. Again, it's on November 10th, so it is coming up very quickly. We invite everybody on this call who is interested to go. We have an amazing committee who's been organizing that, and I'm excited just how different it's going to be. Like if anyone who attended our Dining in the Darks in the past, this is going to be a little bit of a different twist from that. So again, it's on our Arizona chapter Arizona chapter page on the Foundation's listing of all the chapters. On that, I also did want to mention too that Artemis has shared is that we just rolled out our Arizona resources. So we link to resources if someone is newly diagnosed and they don't know where to turn, and when they're ready for that to look for resources, we have links in there. We also have a PDF that has various resources throughout the state that they can go to for independent living, support groups, assistive technology. We list all of those on there. So I'm very excited and encourage everybody to go onto the Foundation's page and look for that resource there.
Wonderful.
Thank you, Phi.
Yeah, thank you.
Thank you, Artemis.
Well, we have about 5 minutes left in our first Arizona Visionaries meeting. I do want to remind everybody that if you would like to view the recording of this session, you can visit fightingblindness.org/foundation-forums. All of the presenters and founding members with contact information will be listed on that page. Our next meeting will be in January. Our founding member team will meet to decide exactly what date we're going to host our next event, and that will also be posted on the Arizona Visionaries page. For anybody on this meeting today, if you have other organizations or groups that you think would be additive, a good add to this or a good presenter for our next meeting, please feel free to reach out to myself or Andrew or any of the founding members to just share your thoughts and ideas. We do encourage you to invite other professionals to join us, and we do want to hear from you if you have other ideas about who would be good to add to this group. Do any of our founding members have any final thoughts or comments before we conclude today?
I just think it was a terrific idea, and this is something that I think will continue to grow, and the emphasis, on what all the different types of services I think can grow. And this has been, even though, I think back in many years ago when it was like nobody felt like they had resources, and it's not quite that like that anymore, but it's certainly, I hear all the time from people that I just didn't know where to go or where to reach out to get the help that I needed, and families especially tell me that. And so this is going to be great.
Lots of wonderful support in Arizona. So thanks to all of you. On behalf of the Foundation Fighting Blindness, on behalf of our professional outreach team, thank you again to all those who presented tonight. Thank you for our founding members. And we look forward to seeing all of you on the next Arizona Visionaries meeting. So good night, and we'll speak to all of you soon, hopefully. Thanks again, everyone.